Hello friends, today we will learn about types, causes, diagnosis, treatment, and prevention of heart diseases. Heart disease types, causes, diagnosis, treatment, and prevention. Heart disease is a leading cause of death worldwide, and spreading awareness about risks and prevention is the only way to reduce mortality. Heart disease is one of the largest health problems today and a leading cause of death due to lifestyle-related disorders. India itself has a huge burden of heart disease patients, and according to recent estimates, heart disease will account for 39.5% deaths by the year 2030. To understand why heart disease is responsible for such large number of deaths, you need to understand the basics about your heart function and the impact of minor interruptions on heart function that could lead to heart disease. How does the heart function? Your heart is a fist-sized organ, located in the chest region, slightly towards the left, and covered by the rib cage, which pumps oxygen-rich blood, purified blood, throughout the body. When different parts of the body utilize the oxygen, the circulatory system carries the deoxygenated blood back to the heart, from where it is sent to the lungs to get purified with oxygen. The action of pumping of the blood takes place through contraction and relaxation of the heart muscle. This contraction and relaxation is what you call a heartbeat. But the heart needs electric impulse to contract and relax. Naturally, if anything goes wrong with the heart muscle, the circulatory system, or the electric impulse, the heart will suffer. Therefore, heart disease is not a single disease or condition. It is a collection or a group of conditions in which the blood vessels that supply blood to the heart or take it away get damaged, or if the heart is not able to function in its normal way. But other factors like viral infection affecting the heart function also comprises of heart disease. Types of heart disease. There are more than 60 different forms of heart disease. Here are the most common ones found among people all over the world. 1. Coronary heart disease. Coronary heart disease is also called coronary artery disease. It affects or damages coronary arteries that supply blood to the heart. 2. Angina pectoris. Angina or angina pectoris is a condition, or rather a symptom, of coronary heart disease. It is a feeling of nagging pain, tightness, and discomfort in the chest region when the heart does not receive enough blood. 3. Cardiomyopathy. Cardiomyopathy is a condition in which the heart muscle that helps to pump blood throughout the body becomes weak. 4. Congenital heart disease. It is a defect, structural or functional, found in the hearts of individuals, right at the time of birth. 5. Arrhythmia. It is a condition causing irregular heartbeat due to improper electric impulses received by the heart. It can either cause the heart to beat very fast, tachycardia, or very slow, bradycardia. 6. Congestive heart failure. Heart failure occurs when the heart is unable to pump blood throughout the body effectively. Congestive heart failure occurs when excess fluid builds up in the body because of heart failure, affecting the filtration function of the kidneys and causing congestion. 7. Atrial fibrillation. It occurs due to arrhythmia, when rapid electrical impulse causes the heart to fibrillate, contract very fast and irregularly. 8. Heart inflammation. Myocarditis and pericarditis. The heart tissue can get inflamed due to a viral infection of the heart. 9. Myocardial Infarction. It is a complicated term used for heart attack, when the blood supply to the heart is completely blocked due to narrowing of blood vessels. 10. Ischemic heart disease. It is caused when the blood supply to the heart is reduced due to partial block of blood vessels and can lead to heart attack and other heart disease. Causes and risk factors. Well, every type of heart disease will have its own set of causes and risk factors, but, by large, the cause of heart disease lies in malfunctioning of the blood vessels, heart muscle, or electric impulses signaling the heart, as mentioned above. Here are some modifiable and non-modifiable risk factors that can lead to heart disease. 1. Family history. If you have a relative who is suffering from a heart disease, you're likely to suffer from the condition. The risk is higher if any of your immediate relatives have had a heart attack before the age of 55 years. 2. Age. Age is a major risk factor for heart disease, CVD. The lifetime risk factor is high for both men and women at the age of 40 years. But, women should worry about age as a risk factor at 55, provided all other risk factors are controlled. 3. Gender. Women, on an average, suffer from heart disease approximately 9 years later than men, but the progression is faster in them as compared to men. 4. Ethnicity. Genetic differences and environmental factors play a role determining lifetime risk factor for heart disease. Indians are at a high risk, but the risk is higher in Americans Indians as compared to Indians. Here are some modifiable risk factors that can be controlled to reduce the risk of heart disease. 1. High blood sugar. People with diabetes have 3 times higher risk of suffering coronary heart disease or stroke and a 4 times greater risk of dying due to heart disease. 2. Hypertension. Hypertension means increased blood pressure on the walls of the arteries. If not controlled properly, this increased pressure can cause thickening of the blood vessels. 3. Smoking. If you smoke, you're twice likely to suffer from heart disease than people who don't smoke. The risk further varies with the duration and frequency of smoking. 4. High cholesterol. When the blood level of bad cholesterol, LDL, is high, cholesterol gets deposited on the walls of the arteries and blocks arteries, restricting the blood flow, resulting in heart disease. 5. High triglyceride level. In India, high level of triglycerides is a big concern and also determines your overall risk of heart disease. 6. Obesity. If you're overweight, you are 6 times more likely to suffer from heart disease. Obesity is linked to most of the other risk factors of heart disease. Symptoms of heart disease. Heart disease is a silent killer as it progresses slowly and is symptomless during the initial stages. But a person could start developing heart disease at a very young age and show the symptoms not before reaching 50s or 60s. Again, the signs or symptoms of heart disease may not be the same for every type. Here are the most common signs associated with heart disease. 1. Shortness of breath. Dyspnea. Breathlessness is commonly experienced by patients with heart failure. It is also a warning sign of heart attack. 2. Chest pain. Chest pain, angina, is a classic symptom of heart attack and coronary artery disease, CAD. In some cases, chest pain is associated with inflammation of the tissue covering the heart, pericardium. 3. Swelling of feet. Swelling in the feet and ankles is seen in people with congestive heart failure where the blood pumping capacity of the heart reduces. 4. Cold sweat. A person who is likely to get a heart attack sooner may start sweating profusely without any physical exertion. 5. Tiredness or fatigue. It is one of the common symptoms of heart failure and heart attack in women is unexplained overall weakness and fatigue. Fatigue is also common in the elderly population or people with diabetes who suffer from heart disease. If you have any of the above signs, you should consult a cardiologist and get your heart checkup done before any complication arises. Diagnosis of heart disease. Screening for heart function is a must, especially if you have non-modifiable risk factors that increase your susceptibility to heart disease. People who already have high cholesterol, triglycerides, BP need to be extra careful and frequent with screening of heart function. 1. Blood test. Blood is the pool of several markers like blood sugar, fibrinogen level, C-reactive protein, and lipids, pointing at your possibility of developing heart disease. 2. X-ray. Chest X-ray is a simple, useful imaging test for diagnosing a lot of heart conditions like congestive heart failure, enlargement of the heart and heart infections. 3. ECG. ECG or electrocardiogram is a useful test to assess heart rhythm and related heart conditions. It measures electrical activity of the heart. Treatment of heart disease. Lifestyle changes or diet medication form a major part of treatment of heart disease. But heart disease can be treated with medicines and surgical interventions depending on your condition. Medicines for heart disease. There are several classes of drugs that help in treatment of heart disease depending on factors that pose a risk. Cholesterol-lowering drugs, statins, help to reduce cholesterol, thereby preventing plaque formation leading to heart disease due to atherosclerosis. Anticoagulants, blood-thinning agents, are prescribed to prevent clotting of blood and enlargement of existing blood clots. Diuretics are a class of drugs used to decrease fluid accumulation in the body. They are prescribed to patients with high blood pressure. Antiplatelet drugs like aspirin may be recommended to prevent blood clotting. Beta blockers are another class of drugs that are used to slow down the heart rate and lessen the contracting force with which the heart beats. Nitrates or nitroglycerin are usually prescribed to patients who have chest pain. Surgical intervention. Due to improved healthcare and technology, heart disease can be well treated with heart surgeries. Here are some commonly used surgical treatments. Angioplasty. It is the most common surgery performed to open up blocked arteries in patients with coronary heart disease with the help of a small device called stent. Here are indications, procedure, risks of angioplasty. Bypass surgery. In this surgery, a healthy blood vessel is used to form a bypass or another route for the heart to pump blood to the other body parts to make up for a blockage in a coronary heart artery. This new blood vessel is called a graft, and the proper name for the procedure is coronary artery bypass graft surgery. Pacemaker implantation. A pacemaker may be implanted in patients with congestive heart failure or cardiomyopathy. Pacemaker is a tiny device that transmits electric signals to the heart muscle, helping it to maintain a heart rate and rhythm. Heart transplant. Heart transplant is rarely performed because acquiring a healthy heart is difficult and matching the recipient is even more difficult. Prevention of heart disease. Although you cannot do anything about the non-modifiable risk factors, you manage controllable risk factors and easily reduce your overall heart disease risk. Dr. Ashish Contractor, Head of Department, Preventive Cardiology and Rehabilitation of the Asian Heart Institute, Mumbai offers some tips to prevent heart disease. 1. Quit smoking. Even occasional or social smoking is dangerous and increases the risk of heart disease. The good news is that no matter how long you have been smoking, you will feel better and begin reaping rewards as soon as you kick the habit. 2. Eat healthy food. Eating healthy is a starting point of keeping heart disease at bay. Simple changes like switching to heart-healthy cooking oils, limiting salt and sugar can help prevent heart disease. Add more fresh fruits and vegetables to your diet. 3. Avoid leading a sedentary lifestyle. Exercising daily is a must, even if it is for 30 to 45 minutes. Regular physical activity helps you control your weight and reduce your chances of developing conditions such as high blood pressure, high cholesterol, and diabetes, which may put a strain on your heart. If you have some other tips, please do share with other readers in our comments section. To stay up to date with my latest videos and amazing health tips, make sure to subscribe to this YouTube channel by clicking the subscribe button, and do not forget to press the bell icon to never miss another update. Thanks for watching.